What was it initially that inspired you to get into mental health?
So, growing up, I always had a real interest in introspection
Mm,
for myself. And I'm from a South Asian family.
hmm.
And I noticed within my family there was a lot of mental health stigma
Mm,
and not a lot of importance placed on mental health. And I think from a young age, something about that didn't sit right with me.
yeah.
And I knew I needed to explore more. And that is where my interest in mental health really began. And then when I was in medical school, actually, my uncle died by suicide. And that
Oh,
was the first person in my family to pass
hmm,
away. And
hmm.
my extended family and my immediate family had a lot of trouble dealing with
Hmm.
that situation. And there was a lot of stigma within my own family and also how they shared the news with the South Asian community.
Oof.
And uh, that hit me really hard and
Hmm.
made me very interested in battling this mental health stigma that I saw within my own community and
Oh,
wanting to be a voice for those and other people. And
hmm.
I have a lot of younger cousins. Like, I have 30 first cousins, and
Oh,
I
wow.
have many younger cousins, and I've seen them through the years struggle with mental health as well. And so to be someone who can be there for them as like a role model and also to allow them to know that they have support and struggling is normal.
Hmm.
And, uh, you know, we can help and support people through that was really important to me. And so that's why
Wow.
I was interested in mental health in the first place.
My next question for you is, as you were sort of navigating this space, did you have, sort of honing in on your field of focus within your practice? What was that like for you? How did you narrow down the kind of patients or clients that you wanted to work with?
Um, I think for myself, I definitely feel a connection to other immigrant patients and other
Hmm.
patients who are, first gen, second gen immigrants. There's a lot of mental health issues specifically in like second generation immigrants, parents who grew up in a different country and then moved here, and then you're born here, but you're battling between, two different
Hmm.
societies.
Yep.
And with that, there can definitely be increases in anxiety, depression, PTSD. And so I think that
Hmm.
being my own like lived experience as like a second generation immigrant
Hmm.
was pretty important to me. So I do feel a pull towards those patients. I am definitely interested in working with patients with trauma histories. I think all of
Hmm.
us have gone through different difficult things in our lives, and
Hmm.
I don't think there for a long time there really has been a space for that to process that and be able
Hmm.
to understand it on a deeper level. And working with patients through like that trauma focused lens has been important to me and something that I've been interested in as
Hmm.
well. I also would say I gravitate more towards like adolescents, young adults. I think it's just a period of time where there's a lot of learning that's going on. And if you can be someone who can help people through that time period where there can be a lot of difficulties, you can really help set them up for like long term success.
Yes.
And it makes me think for myself if I had somebody at that period of my life who could have been there for me, that could have, helped and made a difference in ways. So if I can be that difference to other people during that period of time, then that is amazing.
Realistically, when you look at things like the loneliness epidemic, the advancement of AI and technology, the way we're using it, and how we have lost this ability to connect as humans because we're so disconnected through technology. What are your thoughts on that, just from a mental health perspective?
Yeah, I mean, we're definitely in a very difficult period of time with
Hmm.
technology. And like you're saying, in one way, there are these positives where we can, maybe talk to somebody that we wouldn't be able to talk to like all of the time, or,
Yep.
we can connect with somebody for some amount of time, or we can meet online friends or something like that. Some people that you may have never been able to meet before. But exactly as you're saying, I really feel like social media, technology, uh, has been a really big difficulty, and it really has contributed to this epidemic of feeling like you are connected in some ways, but not really feeling that deep connection. There's nothing I think
Yes.
that really replaces that human connection,
Yes.
and technology, I feel like, doesn't do that.
No.
Uh, there's
Yep.
also, it's really easy for anybody to be on their phone and scroll and scroll. I mean, the algorithms are there to keep us addicted to them.
Yep.
And it's easy to just be in your phone as opposed to living your real life. And I know
Yes.
that's something that I've seen uh, be a significant problem for adolescents, teens, I mean, even like any age group.
Yep.
And with that, when your phone is like your primary source of connection, entertainment, there is a lot more loneliness and an increase in anxiety, depression. And so I do worry about where our society is going in terms of that. And I do very much feel like there should be regulations on technology in these ways, especially
Hmm.
for this age group, just with the data and what we've seen so far and how it affects adolescents and teens. And there's a lot of body image issues that come up when you're on social media, especially if you're like a young teenage girl and you're seeing like all of these Instagram models or all of these TikTok models and comparing yourself to them. It's just kind of this very negative feedback loop. And
Yep.
it's definitely a difficult time.
And my son's 9, and he asked me the other day, like, "Dad, when am I going to get a phone?" I was like, "When you're done with college." Like, that was my legit response. I'm like, "Do you mean flip phone? Because we could talk about that."
Yeah.
um, it's interesting. The kids are getting younger and younger. They have more of an awareness of technology. So it's fascinating. I mean, that's a whole other interview topic right there. But I'll close it out with this fun question: what is one unique fact, hobby, thing that maybe doesn't exist on LinkedIn that is very interesting about Dr. Moo that maybe no one else would be able to find anywhere on any professional networking platform or resume? Tell us something interesting.
Hmm. I have to think about that one for a second. Something interesting that I haven't shared, I guess, on.
Yeah, it's
Uh,
funny putting myself on the spot. Like, I wouldn't know how to answer that actually, but I think what comes to mind, like, I'll go first. What comes to mind for me is I was allergic to cats for my entire life until I fell in love with my girlfriend, who's now my wife, who had a
uh-huh.
cat. And now I'm no longer allergic to cats, and I
Oh,
love cats. So I don't know how that happened, but that is an interesting fact about me that I became an accidental cat person, and I'm now no longer allergic. And I
oh
have
wow,
no idea how that happened.
that's amazing. I wish everybody
Yeah.
could get rid of their cat allergies in that
Yeah,
way.
right. I feel like relationships would be saved.
Oh, this is one. I used to take swimming lessons when I was a kid,
Mm.
but there is like a lot of stigma in South Asian communities with skin color and becoming darker. So actually, then I wasn't allowed
Oh,
to ever go swimming again.
oh
Um,
man.
and then I like, got older and wanted to go to the pool, those kinds of things. And now I
Oh
completely
wow.
know how to swim. So I lost that ability